We have been talking about DPIA for the last few days. In today's video, I have picked up an example from a healthcare provider to showcase how DPIA can help. This is for a customer application, so this can be applied for others as well, but this specific is for healthcare providers. Welcome to my YouTube channel where you have been watching new content on data privacy on a daily basis. Very quick recap of what DPIA is, Data Protection Impact Assessment. You want to reassess your data processing activities, processes to see that there is no risk of breach. And if there's any, then you mitigate it. You enjoy this assessment to help you find out the risk and help you mitigate it before the actual bad things happen, as well as get you closer to being compliant, because then you can showcase to your regulators that you are, you have done it recently and you are safe from all these points. Until of course if they want to perform some tests on their own as well. But better reporting for sure, both for compliance stakeholders as well as for the customers. So this healthcare provider, like any other business, wants an online app so that their patients and prospects can register, share their information, talk to the doctors, book appointments, book their tests, and the lab gives them the report. It's not as short as it looks like. You get registered, you book your test, someone will collect a sample, the report will come to you. Is the test done within the hospital or outside? Is the doctor who is watching the report a part of the hospital or is outsourced one? And you have providers where there is only an app. There is no hospital or lab behind, right? You have patients on one side and doctors on the other side. So what are the kind of risks that such apps can happen? Well, it could be an unauthorized access to the records, first risk. All users need to have access to only their data. Lab can access a limited thing, not everything, right? For patients where a report is to be dispatched, for patients where you have to go and collect samples, the lab person may need the address. But if the patient has booked a test and come to the hospital to deliver the sample, then the lab does not even need the address. So the app should have these things mapped. Consent mechanism, is the user aware how his data is going to be handled? Is he okay with that? Data security, is it safe and secure? Are you encrypting it? Are you ensuring it is not lost, decrypted in between when it leaves the device of the user the moment he presses the save button? And what is the kind of third party access that you have, both for the lab owners as well as for your doctors? So the DPIA process is simple. It says map your data flow from the time of registration till the time of sharing, and I would say even till the time you need the record, which is not very valid in healthcare, because you need the record for the lifetime of the patient and maybe even 10 years after that by healthcare regulations itself, even if not by DPDP. So you need to map your data flows. You need to ensure that the data is collected, like I gave the previous example. If the sample is to be delivered by the patient to the hospital, then the lab does not need the address. Lab needs the address only if someone is to collect the sample or if the address is to be, if the report is to be dispatched physically. So the system should be mapped accordingly. Maybe in that case, if it is only a booking of a doctor appointment and the patient is coming and meeting the doctor, uploading his past reports or whatever, or uploading reports from some other lab, my app doesn't even need the address. Why should I get into the risk of collecting the address? So you do the entire data mapping, engage with your IT and business owners. Both have a critical role. Does the business owner need the address like the example I gave? No, he does not. In some cases, and he does in some other cases. IT team needs to help you find out how are the users and third parties accessing the app. Is the data encrypted? And what is the consent mechanism? These are IT enablers. ITs are not business deciders. The business owner will tell you what minimum information is required. And then you collect information accordingly. Do not collect anything that is not required. Someone wants to visit the doctor to the hospital and is just fixing up time for that. You don't need the address. Right? He'll come to the hospital, tell his name and phone number, you check, yeah, there is a booking. Fine. Done. You don't need the address. What type of consent is required by the business owner who is conducting the test? To whom is he going to share the information? What is the purpose of sharing this information? This all bare minimum data in this particular case that you as a DPO needs. Mitigate the strategies of the risk that you see. What are the visible risks? We have spoken about it. Who is accessing? How is he accessing? Do I need everything? Can I reduce the amount of data I need? That helps me optimize the resources as well as reduces the chances of risk. If I have only the name and phone number of a patient and that gets breached, someone may call him and send him messages. But if I address also that I never needed and has got breached, why did I take that risk at the first place itself, right? Ensure that there are third-party compliance audits. Your labs and your doctors cannot go scot-free, especially labs. They have to be strict contracts, NDAs, and third-party audits with respect to data privacy done with the labs also. Your IT team should implement multi-factor authentications. You should authenticate their email ID and phone numbers when they are registering so that the reports do not reach wrong email IDs or wrong phone numbers. Have role-based access. Maybe you have multiple labs, maybe you have multiple doctors, right? So if one patient is booking a set of tests and for a critical illness he needs a report to be delivered, non-critical illness he is okay to see online, and these are two different labs. So you need to map your entire strategy accordingly. Ensure it is encrypted if there is a critical illness, critical personal information. In any case, healthcare is sensitive and critical. Try pseudonymization, anonymization also. There is a bit more of cost but a lot more of security. And obtain an explicit consent for sharing data. I'm going to tag my consent management playlist over here so that you can go through consent management systems and forms and increase your knowledge. I'll tag the relevance of DPIA etc. also in my video in the previous slides. Collect as minimum data as required by the business and present a very clear consent management forms. Don't just have half-cut forms, right? Clear language, clear icons, easy to understand, clear purpose definition. Outcomes of this DPIA which happened where the IT and the business said what we are doing is perfect, right? Outcomes. More secure processing, safer and restricted access to the users. Generally we would say this is a very basic thing that everyone would do. Well, encryption is not that everyone does. Anonymization may also be required as I mentioned earlier. So you have encrypted data. Data is minimized in this case. Don't take addresses until it is required. You don't need them, don't take that. Explicit consent is obtained so the patient has no confusion about how his data is being handled and who all are handling his data. Third-party audits are conducted that ensures that the processing of this personal data outside your hospital is as safe as inside your hospital and the privacy breach risk is heavily reduced. So that's one of the examples of our healthcare providers. In the times to come, I'll discuss more such examples. But DPIA helped a lot to this healthcare provider to have a much better, safer app for his users and enjoy all the benefits of DPIA. I'm going to tag my playlist on DPIA on this slide so that you can go through the benefits of DPIA again if you have not already done that. One big thing, increase patient trust. Build your customers' confidence in you and get better revenues. What are the needs and benefits of DPIA in brief? Clear implementation of standards, secure data access, lab access also restricted to patient IDs and samples. Lab does not need addresses unless they have to collect the sample or if they have to dispatch the report. And then their collection and dispatch might also be further outsourced, so you have to map them properly. Lab team should ideally not have access to the personal information of the patient. New tests get added, they follow the existing system. New labs get added, they follow the existing system. The only thing is third-party audit needs to be done. You can't leave it just like that. Don't take that risk at all. And any new component like labs, third parties, tests, anything get added, they adopt standards by default. DPIAs to be repeated every time you add new guys, new labs, not patients, but at least labs and doctors, and every 3 months being sensitive data. That's about a case study around healthcare providers. I hope you like the content of the video. please press the bell and the like icon, subscribe to my YouTube channel, and share your feedback in the comment section. Thank you.